Welcome to this edition of the First Aid Show. One thing we've talked about on our pet first aid courses is ticks. And also ticks affect humans. And one of the things that can happen when you get bitten by a tick is Lyme disease. Lyme disease is a dangerous disease and it can be carried by ticks. Lyme disease is caused by a bacteria that's carried in the saliva of an infected tick. When you get bitten by a tick, it stays on your skin and sucks up your blood. This process can take 48 to 96 hours, and then the tick can regurgitate the blood back into the wound. This is how the infected saliva enters the body. This is why it's very important to remove the tick as soon as possible. Not all ticks are infected, and there are regional and seasonal variations. Ticks are removed from the base, making sure that you do not squeeze the body, as this will push the infected blood back into the person, increasing the risk of infection. Signs of Lyme disease are not always obvious and immediate. An initial sign is a bullseye-like skin rash where the bite occurred. This is not always the case and can appear slightly different. Some people may have no symptoms and others may show some of the following over a period of time, maybe even up to a month after the bite. Nausea, a rash about 2 to 40 days after the infection, severe headaches, tiredness, flu-like conditions, muscle and joint pain, and finally feeling generally very unwell. The treatment if you think someone has Lyme disease is to contact a doctor immediately.